7 warning signs of a heart attack that people over 70 should never ignore. There is a reality that constantly weighs on the minds of cardiologists. Many seniors do not pass away because a heart attack happened too suddenly, but because they ignored the warning signals their bodies sent days or even weeks in advance. Many people think a heart attack always begins with an intense, crushing chest pain that makes a person collapse immediately. But in reality, especially for those over 70, this is not always the case. The body often sends out very subtle signals. Some people just feel more tired than usual. Others feel short of breath while walking. Some might think they just have a stomach ache or shoulder pain due to old age. Because these symptoms feel so much like everyday life, many people accidentally miss the golden window for treatment. The heart is an organ that never stops working. Every day, our heart beats about 100,000 times to pump thousands of gallons of blood to nourish the entire body. When the coronary arteries become narrow or blocked, the heart muscle begins to lack oxygen. Initially, the body will send out warning signals. If caught, early doctors can intervene before the damage becomes severe. But if those signs are taken lightly, a heart attack can strike at any moment. In today's video, we will explore 7 critical warning signs that people over 70 should absolutely never ignore. And this is not meant to make you worry, but to help you understand your body better and know when to seek medical help. Sign number 1, a feeling of chest pressure or heaviness that appears repeatedly. When thinking about a heart attack, most people immediately imagine a sharp pain in the center of the chest. However, in older adults, this symptom is often much more subtle. Instead of sharp pain, many people describe it as if someone placed a heavy object on their chest. Some feel their chest tightening or a sense of discomfort or burning. Others only feel chest pressure for a few minutes and then it goes away, so they think it is nothing to worry about. This is exactly why many cases are missed. Usually chest discomfort related to the heart appears when the body has to work harder than usual. For example, when climbing stairs, walking fast, carrying heavy groceries, or during intense emotions. At these times, the heart needs more oxygen, but if the coronary arteries are narrowed, the insufficient blood supply creates discomfort in the chest area. It is worth noting that chest pressure may decrease with rest. This leads many to mistakenly believe they are just tired. If you notice that in recent weeks, you frequently have a heavy feeling in your chest whenever you move, even if it only lasts a few minutes, it is a signal you should not ignore. In people over 70, coronary artery disease develops silently over many years. Plaque builds up slowly inside the vessel walls, reducing blood flow to the heart. Initially, the body adapts, but when the vessel becomes too narrow, symptoms begin to appear. Especially if the chest pressure is accompanied by shortness of breath, nausea, cold sweats, or pain radiating to the left shoulder, you need to get to a medical facility as soon as possible. A very common mistake is buying over-the-counter stomach medicine or painkillers. Although some digestive issues also cause chest discomfort, self-treating, without knowing the cause, can delay a diagnosis if the problem is actually coming from the heart. So do not think that danger only exists when the pain is severe. Sometimes those mild but repetitive chest pressures are the earliest warning. Sign number 2, shortness of breath, even with light activity. Have you ever noticed yourself needing to stop for a break after walking a very short distance? Or perhaps you used to climb stairs easily, but now just a few steps leave you gasping for air. This is a change that many seniors assume is completely normal due to age. Actually, as we get older, our physical stamina may decrease. However, if your ability to move drops quickly in a short period, especially with a feeling of being more winded than before, you should not ignore it. When the heart is not pumping effectively, the oxygen supply to the muscles decreases. At the same time, blood can back up into the lungs, making oxygen exchange more difficult. This is why patients feel short of breath even with light exertion. Initially, symptoms only appear when walking fast or climbing stairs. Later, the person begins to feel short of breath while doing housework, getting dressed, or even when talking for a long time. In more advanced stages, many people have to prop themselves up with 2 or 3 pillows to sleep because lying flat makes them feel like they are suffocating. If you find yourself frequently waking up at night, feeling like you lack air or needing to sit up to breathe, easier talk to your doctor as soon as possible. Not every case of shortness of breath is caused by the heart, lung disease, asthma, or anemia, can also cause similar symptoms. Therefore, seeing a doctor to find the correct cause is very important. Another point to note is that many older people gradually reduce their activity levels to avoid feeling short of breath. They walk slower, rest more, and think their health is still normal. This unintentionally hides the progression of heart disease for many months. If you find yourself doing less than before for no clear reason, consider it a signal to check your heart health. Sign number 3, prolonged fatigue without a clear cause. This is perhaps the most easily overlooked sign in older adults. Many people over 70 assume that feeling tired is completely normal. They think that as they age, health naturally declines, so moving slower, working less, and getting tired faster is inevitable. That is true to an extent. However, there is a big difference between fatigue from old age and fatigue because the heart is struggling. If you used to be able to tend to a small garden, sweep the yard, cook, or go to the grocery store without much trouble, but in the last few weeks, even very light tasks leave you exhausted, this could be a notable signal. The heart is like a pump that supplies blood to the entire body. When the heart works inefficiently, the amount of oxygen-rich blood reaching the muscles decreases. Cells do not receive enough energy, so the body stays in a state of low vitality. Many people describe this feeling like a phone battery that is only at 10%. Even if they just start a small task, they already feel like they need to quit. The significant thing is that this condition does not improve much even after a full night's sleep. You wake up in the morning but still feel sluggish. You feel tired, even while sitting and watching television. You no longer have the energy for activities you once loved. Some people also feel less mentally sharp, have trouble concentrating, or are more forgetful than usual. These are signs that can appear when the heart is no longer providing enough blood to the brain and other organs. Cardiologists often pay close attention to this symptom in older women. Many studies show that women sometimes do not have typical chest pain before a heart attack. Instead, they only experience prolonged fatigue for several days or weeks. Therefore, if you or a loved one suddenly has a clear drop in daily functioning without a logical reason, be proactive and get a checkup. Of course, fatigue can also stem from many other causes, such as anemia, hypothyroidism, infection, insomnia, or medication side effects. But instead of guessing your illness, the most important thing is to identify the real cause. A simple checkup can help detect many heart problems early before they become serious. Never think to yourself that I am old, so being tired is normal. Sometimes that very thought causes many people to miss the opportunity for treatment at the earliest stage. Sign number 4, pain radiating to the shoulder, arm, neck, jaw, or back. When the heart is in trouble, the feeling of pain is not always located in the chest. This is something that surprises many people. Some people feel pain in their left shoulder, some feel it in their arm, some only feel pain in the lower jaw. Some even only experience upper back pain. Why is that? The reason is that the nerves carrying pain signals from the heart and from these other areas share some of the same pathways to the brain. Sometimes the brain cannot accurately distinguish the source of the pain, so it creates a phenomenon called referred pain. This is why many people think they just have shoulder pain from carrying something heavy or neck pain from sleeping in the wrong position. If the pain appears after exertion and decreases with rest, you should pay even more attention. Especially pain radiating down the left arm is one of the classic signs of a heart attack. However, that does not mean pain on the right side is safe. Some people can still feel pain in the right shoulder or both sides. The important thing is that the pain appears unusually and is not like previous muscle or joint pains. For example, muscle pain usually increases when moving or when pressing on the painful spot. Meanwhile, heart-related pain usually does not change much when you twist your body or move your arm. If the pain is accompanied by shortness of breath, cold sweats, nausea, or chest pressure, do not wait to see if the symptoms go away on their own. Time is a critical factor in treating a heart attack. Every minute that passes a part of the heart muscle can be damaged if it is not supplied with blood in time. That is why doctors always encourage patients to get to a medical facility as soon as possible when suspicious signs appear. Do not drive yourself if you feel lightheaded or have severe chest pain. Ask a loved one to drive you, or call 911 if symptoms are serious. Sign number 5, cold sweats without a clear reason. You are sitting and resting in an air-conditioned room. You are not doing any heavy work. The weather is not hot, yet sweat suddenly starts pouring. Your hands are cold. Your forehead is wet. The back of your shirt begins to soak through with sweat. This is not always dangerous. Sometimes it is just a reaction to stress or low blood sugar. However, if this situation appears, along with chest pain, shortness of breath, or a feeling of nausea, it could be a warning sign of a heart attack. When the heart muscle is severely lacking oxygen, the body activates the sympathetic nervous system. This releases hormones, like adrenaline, which increase the heart rate and cause the body to break out in a cold sweat. This is a natural reaction trying to maintain heart function and blood pressure. Many people say they felt cold, sweat, flowing heavily, even though the room temperature was perfectly normal. Some also describe a chilling sensation down their spine, cold hands and feet, and pale skin. If you encounter this situation, especially when it has never happened before, do not write it off as just weather or old age. Stop all activities, sit or lie down in a well-ventilated area, and seek medical support if the symptoms do not quickly improve or are accompanied by other suspicious signs. For those who already have a history of high blood pressure, diabetes, high cholesterol, or have had heart disease, this sign needs even more attention. Remember that the body rarely sends out signals for no reason. Every unusual change is worth listening to and finding out the cause. Getting checked out early does not mean you definitely have heart disease. But if there truly is a problem, early detection always brings a much better chance for treatment. Sign number 6, dizziness, lightheadedness, or fainting. Have you ever stood up from a chair and felt like everything went dark for a few seconds? This is sometimes simply due to blood pressure changing when switching positions too quickly. However, if the feeling of dizziness appears more frequently, lasts longer, or is accompanied by other unusual symptoms, you should not be subjective. The brain is an organ that consumes a lot of oxygen. Just a short drop in blood flow to the brain can make you feel dizzy, lose balance, or feel lightheaded. When the heart is no longer pumping blood, effectively the brain will be one of the first organs affected. Many older adults describe walking normally and then suddenly feeling like their legs are no longer steady, needing to lean against a wall or a chair to stay upright. Some people feel like the room is spinning. Others see their vision blur for a few seconds and then return to normal. These expressions are often blamed on old age or vestibular issues. Although vestibular disease can also cause dizziness if symptoms are new, increasing, or accompanied by chest pressure, shortness of breath, rapid heartbeat, or unusual fatigue, you need a heart checkup. More dangerously, there are cases where the person faints. Fainting occurs when the brain does not receive enough blood to maintain normal function. If a person over 70 suddenly faints without a clear cause, especially after exertion or after chest pain, it is a situation that requires emergency care. Besides, the risks related to the heart fainting also increases the risk of falling for the elderly. A fall can lead to a hip fracture, head injury, or many other serious complications. So do not consider repeated dizzy spells as normal. Remember the time it happened, the circumstances, and accompanying symptoms to provide to the doctor during an exam. This information can help the diagnosis process be faster and more accurate. Sign number 7, nausea, indigestion, or prolonged upper abdominal pain. Many people have no idea that a heart attack sometimes manifests like a digestive illness. You just finished eating and you feel bloated. You have a burning sensation in the upper stomach area. You feel nauseous, lose your appetite, or think you just have indigestion. These symptoms can easily cause a patient to buy stomach medicine without thinking about the heart. This has happened to many patients. And the nerves of the heart and the digestive system are somewhat related. So when the heart lacks blood, discomfort sometimes appears in the upper abdomen, especially in women and the elderly. This manifestation can be clearer than chest pain. If indigestion appears unusually, lasts for many hours or days, and is not like previous times, you should pay attention. Be even more vigilant if the symptoms are accompanied by shortness of breath, unusual fatigue, pain radiating to the shoulder or jaw, cold sweats, or dizziness. A very simple rule is if a strange symptom appears at the same time as many other manifestations do, not just think of a single cause. The body always sends signals in many different ways. The important thing is that we know how to listen, who is at the highest risk. Although a heart attack can happen to anyone, the risk will be higher if you have one or more of the following factors: being over 70 years old, long-term high blood pressure, diabetes, high LDL cholesterol, smoking or having smoked for many years, being overweight or obese, lack of physical activity, having a family member who had early heart disease, having previously had a stroke or coronary artery disease. The good news is that not all risk factors are unchangeable. Some healthy habits can contribute to reducing the risk of heart disease in the future. What should you do if you suspect you are having signs of a heart attack? The first thing is to stop all activity immediately. Do not try to finish your work. Do not try to drive home. Do not think that resting for a few minutes will make it go away on its own. If chest pain lasts more than a few minutes, appears with shortness of breath, cold sweats, nausea, or pain radiating to the shoulder, neck, or arm, call 911 or have a loved one take you to the nearest hospital. You should not drive yourself if you are feeling lightheaded or in a lot of pain. While waiting for medical support, sit or lie in a comfortable position. Stay calm and avoid heavy movement. If a doctor has previously instructed you on using medication for chest pain, follow those instructions exactly. Most importantly, do not delay. In cardiology, there is a very famous saying, time is muscle. That means every minute of delay can cause more heart muscle cells to be damaged. The earlier the intervention, the higher the chance of recovery. How to protect your heart after age 70? No single food or pill can protect the heart if we ignore our daily lifestyle. The most important thing is still maintaining simple but sustainable habits. Try to move in a way that fits your ability. A light walk for about 20 to 30 minutes a day, if permitted by your doctor, can bring many cardiovascular benefits. Prioritize green vegetables, fruits, whole grains, beans, fish, and healthy fats. Limit foods that are too salty, high in sugar, high in saturated fat, and processed foods. Control blood pressure, blood sugar, and cholesterol according to your doctor's guidance. Do not arbitrarily stop medication when you feel your health has stabilized. Getting enough sleep, keeping a relaxed spirit, and limiting prolonged stress also play an important role in protecting heart health. Finally, do not skip regular health checkups. Many heart diseases progress silently for many years before clear symptoms appear. Regular checkups help detect unusual changes early for timely handling. To conclusion, our hearts work tirelessly throughout our lives. After age 70, listening to the small signals the body sends becomes more important than ever. The 7 signs we explored today do not necessarily mean you definitely have heart disease. However, if one or more signs appear, especially when they last recur or go together, be proactive and go to a medical facility to be checked. Early detection not only makes treatment more effective, but can also prevent serious complications in the future. Thank you for taking the time to watch this video to the end. If you found this information helpful, please share the video with loved ones and friends, especially those over 60 or 70, so they also have a chance to recognize these important signs early. Do not forget to like, subscribe to the channel, and turn on notifications so you do not miss the latest health knowledge for seniors. Please note that the content in this video is only intended to provide information and raise health awareness. It does not replace the diagnosis, advice, or treatment of a doctor. If you have any unusual symptoms or are suffering from underlying medical conditions, please talk directly with a healthcare provider for appropriate guidance.